Welcome back to Living 808. In our In Sickness and in Health segment, we're talking about National Hospice and Palliative Care Month. Sheri Richards is a Palliative Care Coordinator for Adventist Health Castle. Thanks for being with us. I appreciate it.
Thanks for having me.
I believe I said that right?
That's correct.
Okay. Palliative care and hospice care. What's the difference between those two?
Well, palliative care can be from the beginning of a diagnosis, where hospice is usually at the very end of life. So you can have palliative care with hospice from the day of a diagnosis to the very end of a diagnosis.
When would somebody need either one of those cares?
Well, because palliative care is a specialty and hospice is a specialty in medicine, and it helps patients who have serious chronic or life-limiting illnesses. It could be, think of somebody like with cancer. It could be from the day of a diagnosis, you know, to help support them. It's all about symptom management. The focus is on pain relief and making sure that the patient is well taken care of.
How do you cope with dealing with seeing people towards the end of their life, or just being in pain? How do you deal with that?
Well, you know, I'll tell you that life and death could be just as beautiful as life is. So if you put it in that perspective, if you allow yourself to believe that, then you can have a beautiful end of life. And how do I deal with that? I cry with the families. I let them know that I'm there for them, and they know that you're human and they are too.
That's pretty amazing. My mother was in hospice, so I know that that's a tough time, but there's ways to handle it. It sounds like you have the right way to handle things like that. Being part of the family, because you guys really are part of the family at that point. We are. We spend a lot of time with our families that spend their last days in our home at Castle, and so I want them to be part of us. What kind of special things do you do at Castle for some of the patients? Oh, we have some great programs. We have what we call our comfort care rooms, which allows them to be in this room that's very large. The family can spend 24 hours there. We have our blanket program, which are all blankets that are donated to us. Our CEO donates many of them. We have staff who makes them for us. They're all specific for each patient and family. It's our gift to them. We have, you know, wall hangings. We get donations from others. We have a comfort card so that we make sure that our families are well taken care of, as well as the patient, because it's all about the entire family. I see that you've brought a couple of tiles with you, and that would be my next question to you. And maybe you can tell folks at home how you're honoring patients and family at Castle. Well, families have the ability to purchase these tiles in honor of their loved ones, for those who we've cared for in the hospital. It's a way of giving back to the community that is there for them. It's a beautiful program, so, you know, it just gives them something of remembrance that we give to them, to the family. Who comes up with what's being said on this? The person gets to however the family wants, as long as it fits into the tile. So amazing. This is really nice. And another, maybe this is a junk question, but where do these go? Where do these We have a specific area along our walkway, a cement wall that they're going on, so that people could go in and see their loved one, a remembrance of their loved one. Thank you so much. This is a really great way of honoring. That one says, in honor of Auntie Leilani. That's really, really nice. That's right. Thank you so much for being with us and telling us a little more. I've learned a little bit, and I hope all of our viewers have too. Thank you. Thank you for having me.